Hi, my name is Gabriella McLenithan. I'd like to thank you for taking the time to view our presentation. Our topic is motivational interviewing and how you can use it as a tool when discussing vaccines with vaccine-hesitant parents.
The objectives of this presentation are to discuss what influences vaccine hesitancy in parents, review the importance of a strong patient-provider relationship, review motivational interviewing strategies, and discuss best practice recommendations for addressing vaccine hesitancy.
What do we mean when we say vaccine hesitancy? Well, the World Health Organization defines it as a reluctance or refusal to vaccinate despite vaccine availability. Research shows that few vaccine-hesitant parents actually withhold the vaccines entirely. Instead, they request for alternate or delayed vaccine schedules. 93% of pediatric providers in the United States have had requests from parents to alternate the vaccine schedule.
There are multiple reasons why addressing vaccine hesitancy is important. The World Health Organization identified vaccine hesitancy as one of the top 10 threats to global health. Vaccination rates currently remain lower than needed for the control of preventable diseases such as flu, measles, and polio in the U.S. Unvaccinated populations usually appear in clusters, including those with non-medical exemptions. With a decrease in vaccination rates, herd immunity decreases and vulnerable populations are exposed. The impact of the hesitancy is much more pronounced in today's world given the increased rate of international travel. Another concern is provider burnout, as providers are spending much more time discussing vaccines with concerned parents. This gives providers less time to discuss other aspects of the child's health and can lead to decreased job satisfaction. Vaccine hesitancy is influenced by a multitude of factors. These include low rates of the particular disease in the current population, unwillingness to expose the healthy child to inoculums, fear of adverse effects, religious or ethical objections, and the belief that natural immunity is better. Many times, the parents feel that they would rather take the low chance of the child contracting the disease instead of the perceived higher risk option of suffering from vaccine-related adverse effects. The emerging interest in natural products and homeopathic medicine also plays a role in vaccine hesitancy. Unfortunately, vaccines have become a victim of their own success. Parents currently are a generation removed from polio, rubella, and other serious vaccine-preventable diseases. Vaccine-preventable diseases are now being described as harmless rites of passage for children and are perceived to be less dangerous than vaccination. Despite vaccine success, some parents have concerns about the necessity and safety of vaccines and are reluctant to have their children vaccinated. Emerging evidence shows that people's belief in misinformation can exacerbate parental concerns, increase risk perceptions, reduce vaccine confidence, and make parents less likely to accept them. There are many resources available for patients to be able to educate themselves and be their own advocate. However, studies show that even if parents try to educate themselves on the risks and benefits of childhood immunizations, their efforts often leave them more frustrated and confused. Without knowing precisely what to search for, parents searching vaccines online most likely encounter more anti-vaccine propaganda than factual, non-biased information.
What you say truly does matter. Engaging the parents in a shared decision-making process is essential to promoting autonomy and preserving the patient-provider relationship. The most critical factor in getting caregivers to accept childhood immunizations is one-on-one contact with an informed, caring, and concerned pediatrician. We often believe that vaccine hesitancy stems from a lack of knowledge, but many studies have shown that approaching the issue based on that notion is highly ineffective and often results in the parents outright refusing the vaccine while losing confidence in their provider. Education-only interventions have been shown to be ineffective when it comes to improving the compliance for vaccines. In fact, much of the literature across several disciplines suggests that simply providing information does not lead people to changing their views, and it can actually lead to a dynamic where the patient or caregiver goes on the defensive and becomes less receptive to new information. The presumptive approach, or operating under the assumption of parental consent, is widely used and most often regarded as the most effective way of approaching the topic of vaccines during office visits. And while the presumptive approach is practical in most cases, it doesn't work in the case of vaccine hesitancy because the parents feel like they're not part of the decision-making process for their child's health.
Let's look at an example of a standard patient-provider interaction.
So, we're meeting today to discuss last month's visit and to plan our next in person visit. Ellie's last in person visit and assessment went really well. She's hitting all the developmental milestones appropriately. But I know you're a first time mom, so I wanted to make sure we take this time to discuss what to expect at your 2 month visit. Just to let you know, she's going to be due for her 2 month vaccines, which are very important. Would you like to vaccinate her at that visit?
I really don't think so. I'm concerned about the reactions. There's just so many vaccines that are given at that one time, and so I don't really think I want to vaccinate.
Well, vaccines are very important in preventing life-threatening diseases. I encourage you to think about it and let my office know if you change your mind, okay?
Okay, thank you. Motivational interviewing uses patient centered, open ended questions to identify health beliefs, address concerns, and determine what may help change the parent's mind. Motivational interviewing decreases the risk of arguments or tension between provider and parent, and it helps prevent parental defensiveness. Rather than questioning why the parent chooses not to vaccinate, it focuses on their readiness to change and looks into their motivation to change. Instead of listing facts about why vaccination is the right thing to do, motivational interviewing uses empathy to adequately address the parent's concerns while offering parental autonomy. Motivational interviewing is a caring, collaborative approach that allows the provider to ask open ended, non judgmental questions to identify underlying health beliefs, parental concerns, misconception, and misinformation. It helps the provider ease any anxiety the caregiver may feel, debunk myths surrounding vaccines, and increase vaccine compliance and confidence.
Motivational interviewing is a tool that's been around for many years. It originated in the field of psychiatry, specifically around substance abuse, but it can be tailored and used in any field and any practice. Motivational interviewing uses compassion and empathy to explore the patient's own motivation for change and help them identify their own concerns and help them change their own mind instead of us as the provider taking a more authoritative approach and telling them or persuading them to make that change. It uses the trans theoretical model or the stages of change model, which includes pre contemplation, where the patient's not ready for the change, and we can help, as the provider, help them increase their perceptions of the risks of their behavior. The next step is contemplation, where the patient's weighing the pros and cons, and we can help them by helping them explore the alternatives and the risks of not changing. After that comes preparation. This is when we can help them set clear goals and help them develop a realistic plan for making that change. Then there's maintenance, where we can help the patient identify and implement strategies to help prevent relapse. And then relapse. Motivational interviewing has 4 key elements: empathy, collaboration, evocation, and support for autonomy. You can use the acronym ORS to help you remember the key skills for motivational interviewing. O stands for open ended questions. This gives us the opportunity to learn about the patient's values and goals versus closed end questions, which elicit yes or no answers and does not provide a natural flow to the conversation. A stands for affirmations, which can be presented in the form of compliments or statements of appreciation and understanding, which help us build rapport with the patient or a parent. R stands for reflections. This can amplify or reinforce the desire of change and encourage patients' personal exploration. And S stands for summarizing. This ensures mutual understanding of the discussion, points out discrepancies between the patient's current situation and their future goals, and demonstrates listening and understanding of the patient's perspective.
Now let's look at the same scenario, but this time, watch how the provider utilizes motivational interviewing to change the narrative.
Hey, Miss Smith, how are you doing today?
I'm doing okay. How are you?
I'm doing well. So we're meeting today to discuss our last visit with Ellie. her last visit went really well. I'm really happy with her progress. She's meeting all of her milestones. But I know you're a first-time mom, so I wanted to make sure you knew what was going to happen in the next visit. At the 2-month visit, Ellie, we're going to be doing some vaccines for her, which are really important. Would you like to vaccinate her at that visit?
What vaccines is she due for?
So at the 2-month visit, Ellie's going to be receiving the second dose of the Hep B vaccine, hepatitis B, which she received the first dose in the hospital.
Okay.
She's going to be receiving the first dose of the diphtheria, tetanus, whooping cough vaccine, which is a combination, and then the first doses of the HIB vaccine, the polio vaccine, pneumococcal, and rotavirus vaccines.
Wow, that really seems like a lot. Can I think about it a little bit further?
Ellie's mom has indicated that she may have some concerns about required immunizations at today's visit. Let's see how the provider handles the situation using motivational interviewing. Remember, MI uses open ended questions, empathy, reflections, affirmations, and summary.
You seem to have some concerns about Ellie's vaccines. Do you mind sharing them with me? I'd love to explore them with you.
Yeah, it really just seems like that's a lot of vaccines at one time, and I feel bad about her getting stuck so many times. She's really young, and I'm just concerned about her having a reaction and really don't want anything to happen to my baby.
I hear you. You're concerned about how many vaccines we're doing and possible reactions. I completely understand.
Mhm.
Many parents share the same concern as well. I remember having those fears when my children were little. If it makes you feel any better, though, we do combine the vaccines, so Ellie won't be getting as many needle sticks.
Okay. Thank you for understanding. That really makes me feel a little bit better. But what about the reactions? Can her immune system handle all that at one time? I've heard that some vaccinations can cause autism and even Alzheimer's down the line, and I really don't want anything to happen to her.
While research shows that education only interventions are not effective, correcting misinformation is very important during this time. However, watch how the provider approaches the patient to minimize possible confrontation.
I actually hear those concerns all the time, so I did some research on it. Do you mind if I share my findings with you?
Please.
Yeah, so the research that linked the vaccines to autism and Alzheimer's have actually been debunked. It turns out that those doctors falsified their records and their results, and they've actually lost their medical licenses.
Really? I didn't even know that.
Absolutely. And in terms of her immune system, if it makes you feel better, we can space the vaccines out. However, the immune system reacts the same regardless of how many vaccines we do at one time. But ultimately, this is a decision only you can make. So, do you have any further questions?
No, I actually think that you've answered them all, and let's go ahead and move forward with all the vaccines.
Wonderful. I look forward to seeing you and Ellie at the next visit, and we can talk some more about the vaccines at that time too before we give them, okay?
Perfect. Thank you. I look forward to seeing you then.
All right. Bye, Miss Smith.
Motivational interviewing is a wonderful tool to help the provider assess the parent's mindset and willingness to change. On the next couple of slides, we have provided resources to assist you in making informed recommendations and implementing motivational interviewing into your practice.
We appreciate all that you do and hope you have a great rest of your day. Thank you.